Hello, welcome to this urinary incontinence class. In this class, I'll be speaking about what urinary incontinence is and how physical therapy can help those who experience it. My name is Ebony Jackson Clark. I am a pelvic health physical therapist. I am a board certified clinical specialist in women's health physical therapy and a certified lymphedema therapist. I treat all genders and all diagnoses of pelvic health. In this class, I will be giving an overview of what urinary incontinence is. I will briefly go over anatomy and physiology of the urinary tract. I will cover normal bladder filling and emptying and a few types of urinary incontinence. I'll talk about some causes and risk factors for developing urinary incontinence. And finally, I will be going over how urinary incontinence is diagnosed and some of the treatment options. So what is urinary incontinence? Urinary incontinence is a loss of bladder control that results in the leakage of urine. It is a very common problem, and there is a wide range of what constitutes as urinary incontinence, from a few drops of urine with laughing or sneezing to emptying your entire bladder on your way to the bathroom while jumping or running. Over 25 million adults of all ages in the U.S. experience urinary incontinence. Research shows that over 25% of cisgender women and anywhere between 4 to 34% of cisgender men will experience urinary incontinence. So this is a very common problem. However, just because it's common doesn't mean it's normal and that nothing can be done. Urinary incontinence isn't an inevitable consequence of aging. Lifestyle and dietary changes or medical care can treat symptoms of urinary incontinence. Here's a brief overview of the anatomy and physiology of the urinary system. The urinary system is composed of the following organs. The kidneys receive blood and output urine. The urine then passes from the kidneys via the ureters, which are tubes that connect to the top of the bladder. The bladder stores the urine until it is time to urinate. At that time, the urine will leave through the bottom of the bladder through a tube called the urethra and exit the body. The urethral sphincter and the pelvic floor muscles are muscles that squeeze the urethra to allow the bladder to store urine. When the urethral sphincter and the pelvic floor muscles relax, the urine leaves the bladder through the urethra. Normal bladder filling involves the process of the urine coming from the kidneys via the ureters and being stored in the bladder until it is time to urinate. During this storage phase, the bladder is relaxed while the urethral sphincter and pelvic floor muscles are contracted and close off the bottom of the bladder. The bladder fills at about an average of 15 drops per minute. The first time a person is aware that they have urine in their bladder is called the first sensation to void. Voiding refers to urination or peeing. At the first sensation to void, a person will be aware that they have urine in their bladder, but will not necessarily need to use the restroom. The bladder is only about 1/3 full at this point. The desire to void refers to the time where a person will feel the need to empty their bladder. The bladder will be about 2/3 full at this time. It will hold a little more than about the amount of a can of soda. This is when a person should go to the restroom to empty their bladder. If a person doesn't go at this time and allows their bladder to become fuller, they may start to experience pain at around the time the bladder is 5/6 full. A completely full bladder can only hold about 20 ounces of fluid on average. Fun fact, there is actually not that much difference in the size of a bladder between sexes. Once the pressure inside the bladder reaches its volume threshold, the bladder will begin to contract. When this happens, the sphincter and pelvic floor muscles will relax, and this allows the urine to leave the bladder through the urethra and exit the body. This is called voiding. Here are some key things to know about what constitutes as normal urination. The normal average interval for urination is about every 2 to 4 hours. This means anything under 2 hours is too often, anything over 4 hours is not often enough. This roughly comes out to mean that a person should be using the restroom about 5 to 7 times per day. These are just averages. The interval and the number of times per day will vary based off of your fluid intake and activity level. A person should be using the restroom either 0 to 1 times per night. After the age of 65, a person might need to use the restroom 1 to 2 times a night. In general, when urinating, it should take 8 to 10 seconds to empty your bladder. If a person is taking much less or longer than this to urinate, then they are either not waiting long enough or waiting too long. On average, a person might pass about 1.5 quarts of urine per day. Now, here are a few habits to avoid to maintain healthy bladder storing and emptying. A person should avoid holding in their urine all day. This can encourage bacteria growth, which increases the risk of developing UTIs. It can also cause stretching of the bladder and desensitization of the urge to urinate. If using the toilet, a person should not hover over the toilet. They should sit all the way down to allow the pelvic floor muscles to relax. Remember, the pelvic floor muscles need to relax to allow urine to exit the bladder. Never strain or push hard to try to urinate. This can weaken the pelvic floor muscles if done chronically. It can also increase risk for or worsen hemorrhoids or prolapse. When urinating, a person should never rush. It's best to take the time needed to ensure that all of the urine is expelled and that the bladder can completely empty. Going just in case refers to urinating when you don't have the desire to urinate. The reason to avoid this habit is because we don't want to decrease sensitivity to the normal desire to void. It is okay to do this every once in a while, for example, if you're leaving the house and won't have access to a bathroom for a few hours. Lastly, people with vaginas should never wipe with toilet paper from anus to vagina. This can introduce harmful bacteria into the vagina or urethra and cause infection. Wiping should always happen front to back. There are several types of urinary incontinence. The most common are stress, urge, and mixed. Stress incontinence is when the bladder leaks with pressure, such as coughing, sneezing, laughing, lifting, jumping, running. Urge incontinence is when there is a sudden and intense sensation to urinate and the person is unable to hold in the urine before making it to the toilet. Urge incontinence may be caused by a minor condition such as an infection or a more severe condition such as a neurological disorder or diabetes. Mixed urinary incontinence is when a person experiences both stress and urge incontinence. Many things can cause or exacerbate the onset of urinary incontinence. Infections such as urinary tract infections or vaginal infections, constipation in pregnancy due to the decrease of space available in the pelvic cavity and pressure exerted on the bladder, childbirth due to acute injury of the pelvic floor muscles, changes with age, muscle mass decreases approximately 3 to 8% per decade after the age of 30 and even more so after age 60. Menopause, hormonal changes cause the thinning of the lining of the urethra and the weakening of the pelvic floor muscles. Enlarged prostate, prostate cancer, and obstruction in the urinary tract can all cause blockages along the urinary tract that can interfere with the flow of urine. Neurological disorders such as multiple sclerosis, Parkinson's disease, spinal cord injury, stroke, certain medications, diabetes, and cognitive impairments may cause a person to not be able to make it to the toilet in time. What are some risk factors of developing urinary incontinence? Well, cisgender women are twice as likely to experience urinary incontinence than cisgender men. This is due to anatomical differences. Cisgender men have a longer urethra at about 20 centimeters in length compared to cisgender women who have shorter urethras at about 3 to 4 centimeters in length. And the urethra in cisgender males has an S curve, which helps with continence, while the urethra of cisgender women is basically vertical. With age, we experience a natural loss in muscle starting at age 30. However, this can be combated with regular exercise. Being overweight can increase the pressure on both the bladder and the pelvic floor muscles. Smoking irritates the bladder. It can cause frequency of urination and coughing that increases pressure on the bladder as well. Sisters and daughters of people with urinary incontinence are more at risk to experience it themselves. And some diseases increase the risk of urinary incontinence, such as multiple sclerosis and diabetes. Urinary incontinence is diagnosed by your medical provider. They will take a thorough history of your signs and symptoms. They'll do a physical exam, a bladder diary where times of urination, leaking, food and fluid intake, and activity are noted is very helpful in diagnosing urinary incontinence. A urinalysis tests the appearance, concentration, and content of urine to detect for disorders such as urinary tract infections, kidney disease, and diabetes. Urodynamic testing looks at how well the different parts of the lower urinary tract, the bladder, sphincters, and urethra, work to store and release urine. Now I'll speak about some of the treatments available for urinary incontinence, with an emphasis on those available from physical therapy. It is important to understand how certain foods and fluids can affect the bladder incontinence. Coffee, tea, soda, alcohol, chocolate, tobacco, and smoking, artificial sweeteners, and even certain medications will irritate the bladder. This irritation can increase frequency and urgency of urination and may increase leaking. There are also some foods and drinks that may be irritating to some people but not to others, and those are listed on the right. To tell if a food is a bladder irritant for you, you can cut out bladder irritants from your diet. If your urinary symptoms improve, then you can slowly add one bladder irritant back into your diet. If your symptoms worsen again, then that food is a bladder irritant for you. You may not have to completely eliminate bladder irritants from your diet. You may be able to simply cut down on the amount or consider the timing of your intake of that food to improve urinary continence. Drinking the right amount of water is very important for your health and your ability to control your urination. There are many different ideas on how much water we should be drinking each day. One way to monitor your water intake is to monitor your urine color. Drinking too little water will cause a concentration of body waste products in your urine. Highly concentrated urine is a bladder irritant and may cause frequency or urgency. Drinking too little water will cause the urine to have a strong smell and to be dark in color. Drinking too much water will also cause an increase in frequency and urgency. Drinking too much water too quickly can cause urgency too. Spreading out water intake and drinking small amounts throughout the entire day will help avoid this. Transparent urine is a sign of overhydration. It's okay to stop drinking water about 1 to 2 hours before bed, but don't stop drinking water too much earlier than that. Ideally, urine will be a light yellowish color as seen here in the picture. Urge suppression techniques are techniques used to help regain control of the bladder and to reduce urgency, frequency, and leaking. Urgency is the sense of needing to urinate. It comes in waves and builds in intensity over time. The first urge felt is called the first sensation to void, which occurs when the bladder is about 1/3 full. Generally, people can ignore this urge. Urgency continues to grow until it becomes the desire to void, which occurs when the bladder reaches 2/3 capacity. When a person has difficulty making it to this stage, these urge suppression techniques can help. Sitting down puts pressure on the perineum. This mimics the pressure of the pelvic floor. Remember, when the pelvic floor is contracted, it sends signals to the bladder to relax. This is called an inhibition reflex. Deep breathing calms the nervous system. Urgency is controlled by the nervous system, so calming it will decrease input to the bladder and decrease urgency. Light, quick contractions of the pelvic floor utilize the inhibition reflex between the bladder and the pelvic floor. Light, quick squeezes are better than a single long hold of the pelvic floor to avoid fatigue of the pelvic floor muscles. Distracting yourself with an activity or task is a way to decrease urgency by engaging your mind. Visualization is a similar technique where you visualize yourself in a place or situation where you don't want to leave. Use these techniques to ride the wave of urgency until it passes. Then, if the need to use the restroom still persists, walk slowly and calmly to the bathroom. Rushing may encourage the urge to return. If the urge returns before you make it to the toilet, then use the urge suppression techniques again. Then undress yourself and use the toilet. Double voiding is a technique to help empty the bladder more effectively, especially for those who feel like they do not completely empty their bladders when they urinate. First, proper posture is important for urination. It is helpful in relaxing the pelvic floor muscles to have your hips flexed. This can be achieved by leaning forward with a straight back and having your knees slightly higher than your hips by placing them on a stool or even books. The knees should be apart and the elbows can be rested on the thighs. Make sure to sit completely on the toilet and relax. After urinating, either shift around on the toilet, stand up and move around, or even walk a little for a few seconds. Then sit back down and urinate again. An overactive bladder can wreak havoc on bladder sensitivity and cause a person to feel like they have to urinate much earlier than they need to. Bladder retraining is a way to tackle urge. It involves going to the toilet on a set schedule to gradually increase time between urination. The goal is to allow the bladder to fill more and control the urge to urinate. The first step is to use a bladder diary to find your voiding pattern or how frequently you are urinating. The bladder diary allows you to keep track of how often you're urinating, how much urine you're passing, how often leaks occur and the size of the leaks, and food and drink intake. This will allow you to figure out on average how often you are urinating. The second step is to slowly increase the intervals between voids or urination. You can start with a small increase like 5 to 15 minutes. So if someone is going to the bathroom every 15 minutes, they may want to start by extending their interval to 20 minutes. They will go to the toilet every 20 minutes whether they have the urge or not. Once this becomes easy, they can extend the interval again by 5 to 15 minutes. They will continue slowly increasing their intervals until they reach intervals of 2 to 4 hours. The third step is to stick to the schedule. Immediately use the restroom upon waking up and start from there. Use the urge suppression techniques to reach the interval goals. If an accident is imminent, use the toilet and then immediately return to the schedule. The time intervals should be increased slowly to have the best chance at success. Don't rush the process. With practice and time, the ability to gain control will increase. Pelvic floor muscles are important in maintaining continence. These muscles have several functions. They support the pelvic organs, such as the bladder, rectum, and uterus. They help open and close the urethra and anus to prevent leaking. They work with other core muscles to stabilize the trunk. They support erectile tissues and orgasm, and they are important to blood flow and circulation in the pelvis. These muscles can be rehabilitated like any other muscles in the body to become stronger and more functional. Pelvic health physical therapy is a physical therapy specialty aimed at treating pelvic and abdominal conditions. Some other treatments you might discuss with your care team are certain medications. There are no medications for stress urinary incontinence, but there are some for urge urinary incontinence. Some medical devices, such as pessaries, can be useful in reducing urinary incontinence, especially when there are other conditions such as pelvic organ prolapse present. Your physician may suggest some interventional strategies such as Botox. Surgery is a last resort option should conservative therapy not be effective, and there are various types available. Some lifestyle changes may also help prevent or reduce urinary incontinence. Some drugs that can contribute to bladder control problems are high blood pressure drugs, heart medication, diuretics, muscle relaxants, antihistamines, sedatives, and antidepressants. You'll want to talk to your doctor if you develop incontinence or difficulty urinating while taking these medicines. Maintaining healthy blood sugars is important to prevent the development of type 2 diabetes, which increases the risk of urinary incontinence. Smokers are more likely to have bladder control problems and have more severe symptoms. They may also have a chronic cough, which puts added pressure on the bladder. If you have a chronic cough, you'll want to speak to your doctor about treatment options. Regular physical activity improves bladder control. The CDC recommends at least 30 minutes of moderate activity per day. Constipation can cause straining, which can weaken the pelvic floor. Some medications for bladder control may increase constipation. Exercise, drinking water, eating high fiber foods might help constipation. If they don't, consult your doctor for treatment options. To review the treatments, we talked about avoiding bladder irritants, monitoring fluid intake, urge suppression techniques, double voiding, bladder retraining, pelvic floor muscle training, medical treatments, and lifestyle changes. It is perfectly reasonable to try these techniques out on your own for a few weeks and see if you have any success. If you are not comfortable doing that or need guidance, you may want to ask your doctor to give you a referral to see a pelvic health physical therapist. Here are some resources to check out. Next, we will try out 3 exercises. I spoke about diaphragmatic breathing earlier as an urge suppression technique. It is also a pelvic floor range of motion exercise. Diaphragmatic breathing refers to deep breaths that allow the diaphragm to descend. The diaphragm is the muscle below the lungs that helps you breathe. When it relaxes, it lowers, allowing the lungs to expand and inhale air. When it contracts, it pushes the lungs upwards and exhales air. With diaphragmatic breathing, as opposed to normal quiet breathing, there is more movement of the diaphragm, allowing for deeper breaths. With inhalation, this increases the pressure within the torso and therefore pushes down on the pelvic floor, stretching it. As you can see in the picture, the diaphragm and the pelvic floor work together. One way to know if you're diaphragmatically breathing is to place one hand on your chest over your sternum, then place the other hand on your belly over your belly button. When you take a diaphragmatic breath, the hand on your belly should expand outward, and the hand on your chest should not move at all or barely. Now let's practice. Get your hands in place, one on the belly and one on the chest. We'll do 4 repetitions. Now slowly begin to inhale deeply for a count of 1, 2, 3, 4. Pause, holding your breath for 1, 2, 3, 4. Now slowly exhale for a count of 1, 2, 3, 4. And pause for 1, 2, 3, 4. Again, slowly begin to inhale deeply for a count of 1, 2, 3, 4. Pause, holding your breath for 1, 2, 3, 4. Slowly exhale for a count of 1, 2, 3, 4. And pause for 1, 2, 3, 4. Slowly begin to inhale deeply for a count of 1, 2, 3, 4. Pause, holding your breath for 1, 2, 3, 4. Slowly exhale for a count of 1, 2, 3, 4. And pause for 1, 2, 3, 4. Last time, slowly begin to inhale deeply for a count of 1, 2, 3, 4. Pause, holding your breath for 1, 2, 3, 4. Slowly exhale for a count of 1, 2, 3, 4. And pause for 1, 2, 3, 4. And finished. This form of diaphragmatic breathing with the 4 counts of inhaling, pausing, exhaling, pausing is also known as square or box breathing. Besides being an urge suppression technique and a pelvic floor exercise, it is also used to reduce stress, increase concentration, lower heart rate and blood flow, improve mood, and help with insomnia. The next exercise is a pelvic floor exercise. For this exercise, you will need a towel, pillowcase, or if you happen to have a TheraBand flex bar lying around, you can use that. Take the towel and roll it up nice and tight. Next, place the towel between your legs and sit on it like a bicycle seat. The towel should be firm and not too squishy. You should feel the towel pressing against your perineum, which is the area right in front of your anus. To do the exercise, you will squeeze your pelvic floor like you are trying to stop urine from leaking. When you do this, you should feel less pressure on the towel as your perineum lifts up and away from the towel. Now, completely relax your pelvic floor. You should feel the pressure return to your perineum as it lowers back onto the towel. Let's try that again. Squeeze your pelvic floor, lifting it up and off the towel. Now stop squeezing and relax the pelvic floor. Now let's make sure that the right muscles are activating. Place your hands under your buttocks. Contract your buttocks as if you were about to stand up or lift up off the seat. When you do this, you should feel your buttocks tensing against your hands and you should feel your body lift upwards a little bit. Did these muscles turn on or stay relaxed when you did the pelvic floor squeeze? Let's test it to find out. Leave your hands under your buttocks. Keep the butt muscles relaxed this time. Now, squeeze your pelvic floor like you're stopping the flow of urine. Now relax. When you squeezed your pelvic floor, did your butt muscles tense up too? If your butt muscles stayed relaxed while your perineum lifted up off the towel, then congratulations, you did the pelvic floor contraction correctly. If your butt muscles tensed at the same time or only your butt muscles tensed, then you may want to try again or go see a pelvic floor physical therapist. Let's try one more time. Relax your butt muscles and try to keep them relaxed the whole time. Now, squeeze your pelvic floor, lifting your perineum up off the towel. Now stop squeezing and relax the pelvic floor, feeling the pressure back on the towel. I don't recommend doing this exercise while urinating other than maybe once in a while, as repetitively doing this can interrupt the neurological urination reflexes that exist and can lead to more problems. Now let's try a second pelvic floor exercise. If you didn't get the first one, that's okay, but you may want to skip this one until you get the first one down. Keep the towel between your legs against your perineum for this one too. This exercise is called the knack. It is used to help stop leaking during laughing, coughing, or sneezing. How it works is when you feel a sneeze, laugh, or cough coming on, you will squeeze your pelvic floor before the sneeze, cough, or laugh, and hold the squeeze until it is over. Then you will relax your pelvic floor. Now let's give it a try. Instead of coughing, we will blow out air like we're blowing out a candle. Now go ahead and squeeze your pelvic floor. Feel the pressure lessen as your perineum lifts up off the towel and hold it. Now blow air out of your mouth. Then relax your pelvic floor back onto the towel. If that was easy, then you can make it harder by blowing harder or longer or even trying a cough. If it was difficult, then you can try to blow softer or shorter. Just like in the other exercise, make sure your butt muscles are staying relaxed and that you are only using your pelvic floor muscles. That concludes the urinary incontinence class. Now, before I let you go, I wanted to educate you on other conditions that pelvic health physical therapists treat. If you have any of the following symptoms, then you may benefit from physical therapy. If it hurts when you urinate and has hurt for over 3 months. If when you urinate, your urine stream starts and stops multiple times. If you have to strain or have difficulty urinating or emptying your bowels. If you consistently are leaking gas or have fecal staining on your underwear. If you feel any pressure, bulging, or heaviness in the pelvic region, genitals, or rectum. If you experience pain in the pelvic region, genitals, rectum, or tailbone. If sex or orgasm are painful. If menstruation is extremely painful or debilitating. Any erectile dysfunction, painful ejaculation, premature ejaculation. If you are experiencing low back pain or pelvic pain during pregnancy. Some of the diagnoses and conditions that pelvic floor physical therapists treat are urinary incontinence, bowel and fecal incontinence, urinary retention, IBS and constipation, bladder pain and interstitial cystitis, vaginal and penile pain, rectal pain, coccyx pain, painful menses and endometriosis, pudendal nerve entrapment, pelvic organ prolapse, pelvic surgery recovery such as prostatectomy, hysterectomy, vaginoplasty, pain with sex, erectile dysfunction, painful ejaculation, premature ejaculation, pelvic girdle pain, diastasis recti, low back and sacroiliac joint pain, gynecological cancer recovery, prostate cancer recovery, breast cancer recovery, hypermobility, abdominal pain, and hip dysfunction. Physical therapists are movement experts who work with people of all ages and genders to improve quality of life and help people become healthier and prevent future problems. Thank you for listening. I hope you were able to learn more about urinary incontinence and the treatment options available from physical therapy. If you have any questions, please write them down and bring them with you to your pelvic health physical therapist or physician. If you're interested, there is a Navajo version of this presentation presented by Maylene Harvey available as well, for which I will provide a link. Goodbye.